Hello, friends. My name is Miriam Jensen, and I'm back to you here from the play therapy room. And today I'm going to be speaking about a method that has been developed by Dr. Garry Landreth. He's the father of child-centered play therapy as we know it. And this is a method that I use as needed in the playroom to set limits. It can be very helpful for therapists, for definitely parents, and for educators as well. So this method is called the ACT method, the ACT. The ACT method stands for the A, acknowledge the feeling, the C, communicate the limit, and the T is for targeting an alternative. So basically, it goes like this. Very simple way of putting it is, I know that you are really mad right now, but this wall is not for kicking. You may kick this pillow or a ball outside. This is just a simple example. This is kind of like a classic child-centered play therapy technique for setting boundaries while preserving the connection and the child's sense of autonomy at the same time. So you are not resorting to threats. You are not resorting to do this or else. You are not saying that you are gonna be punished because you are doing so and so. So you are lowering that fear response for the child and helping the child also get to be more responsible and less struggling with the need for power or the need for control, secondary to a lot of anxiety disorders that I see here in the playroom. So you are lowering that power struggle. You are not getting in a power struggle with a child because no one is going to be winning a power struggle, but at the same time you are helping the child follow a safety limit so that they don't get hurt or they don't hurt others or they don't hurt a thing or a toy or something in the house. So and again, you use reason for, like, you use your own logic for that too. But this method, like I said earlier, it comes from Dr. Garry Landreth himself and the work that he did in child-centered play therapy. Some other examples can be maybe a child is throwing blocks. So the A, acknowledging the feeling, you can say, you really want to throw those blocks high in the air. And then communicating the limit would be, but those blocks are not for throwing. And then targeting an alternative, you can again come up with your own, but an example would be, you can throw this softball instead. Or you may choose to throw some balls in the hoop outside instead. And then there's another example, maybe yelling or using loud voices in the house. So it can be, you have a lot of loud energy right now, or you want to really, really talk in a very loud voice right now, or you want to really sing in a loud voice right now, whatever it is. But you can say, but the house is not for yelling, or we can't yell inside because it hurts people's ears. You may yell as loud as you want outside, or you may use this drum to make loud sounds if you are, again, okay with the child making those sounds with a drum instead of yelling at people, for example. And then another example would be maybe grabbing a toy from a sister or a brother's hand. So without asking, so you can say, acknowledging the feeling, you really want that truck right now. You really want to play with that truck, but that truck is in use. You may choose another truck from the shelf or from the toy basket or from your toy collection, or choose to wait until it's your turn and you can get a turn after the other person is done. you don't say after the other person is done, but the less words that you can use is the best. So you really want to use this truck right now, but this truck is in use or someone is using this truck. You may choose to play with another truck or a totally different toy, or you may choose to wait for your turn to play with the truck. So again, you are helping the child, and like, notice that we don't say don't do this, in the whole ACT method. We are not saying do not, we are actually saying you may choose. So you are putting the choice, you are giving power to the child, and you are giving them a choice to make, rather than to tell them what to do. So they will get in that, again, power struggle, and no one is going to be winning a power struggle in that situation. So you can help the child by empowering him or her over anxiety in that way. So that is, in a nutshell, what the ACT method for setting limit is about. And there can be a lot of examples, but these are just three examples that I thought about. Maybe another example for younger children can be someone is scribbling on the wall, for example. So you can say, you really want to draw a nice picture, a beautiful picture right now, but the wall is not for drawing. You may choose to draw a picture on this large paper instead. So again, the same idea. Again, this works because it keeps the connection first. So you are in connection with the child and you see what the child's need is. You also set a clear and calm limit with calm voice. You are not raising your voice. You are not threatening. You are not disconnecting from the child, and also redirecting the child to something else that is acceptable to do. And it prevents, again, power struggles. It models problem solving, so it helps the child get to problem solve for him or herself. And it also protects that safety and structure for the child. So I hope this would be helpful for you. Again, if you are a therapist, if you are an educator, if you are a parent, I hope this would be helpful for you as you go. And if you have any questions, or if you have any thoughts, or if you used something like this but you didn't know it was called the ACT method, please share with me. I would love to hear from you and learn from one another. Have a great rest of your day and enjoy the rest of the week. Bye.